I'm here with Dr. Siddharth Sethi, gastroenterologist and hepatologist, and in this video tutorial we're going to be looking at analgesics and other pain medications and the development of irritable bowel syndrome as opposed to other gastrointestinal symptoms. So Dr. Sethi, I'm wondering, can you talk us through how do you distinguish between just gastrointestinal symptoms that develop as a result of the analgesic and pain medication versus irritable bowel syndrome?
So thanks for your introduction. So how I'd go about distinguishing them is essentially as follows. Patients who have gastrointestinal symptoms from irritable bowel classically have a constellation of symptoms. So the classical IBS symptoms are that it's been present for several months, if not years. They're typically young patients between the ages of 15 to 40. They're more often females than males. A lot of males do have it. They classically have irregular bowel habits, alternating between diarrhea and constipation. They'll have bloating, fullness, and cramps. They'll often classically have reactions to certain foods. So they might eat spicy or hot foods, and then or particular foods like onion and garlic, and feel that they're reacting. Patients who have analgesic-related symptoms often have much more defined, much more specific symptoms as opposed to IBS, where it's a lot more generalized. So patients with analgesic-related symptoms would have often pure constipation by itself from analgesia. They would tend not to have irregular bowel habits or bloating. Patients who have reflux or heartburn, where it's burning sensation, radiating upwards, they would typically have have developed independently. It would not have been caused by taking medication. And the other one is patients who have stomach ulcers from non-steroidals. That can be caused by other conditions, but if they've taken non-steroidals, then one can reasonably attribute the work-related injury as a cause.
Okay, thank you for that. And obviously you are often asked in the medico-legal context whether the examinee is experiencing irritable bowel syndrome as a result of the non-steroidal or the analgesic medication. How frequent is it that the medication is causing these kinds of causing this underlying presentation as opposed to it being just a gastrointestinal symptom?
So so basically, so the funny thing is in my experience, lawyers and companies, insurance companies, usually don't ask if patients have irritable bowel. That they usually tend not to ask that. So, but I would say irritable bowel does account for a large percentage of symptoms. I would say it's a fairly high number. So I won't be able to give you exact percentage, but it's a fairly. I mean, IBS is the highest. It probably accounts for 50% of all gastroenterology consultations.
Okay, so in about 50% of the presentations would have happened anyway, injury or no.
That's correct, yes.
Okay. So do you have any advice then for referrers in terms of trying to identify IBS versus the gastrointestinal symptoms? How should they ask you those kinds of questions? And what recommendations do you have over, decades worth of working as a gastroenterologist and hepatologist? What advice would you have for a referrer in terms of trying to work out what's really going on in these kinds of scenarios?
I would basically ask the claimant as to when their symptoms developed. I'd ask them for a timeline. So essentially, patients often will say have an injury, for argument's sake, in 2013. Start analgesic shortly after, but then not develop their symptoms till 3 or 4 years later. And in fact, having such a long gap between medication or commencement or injury and symptom onset would go very strongly against any causative role. So they should probably very closely look at timelines. They should ask specific questions. I think a good question they should ask is, what is, in your opinion, would this patient have developed this condition regardless of whether the injury occurred or not, or is it? And the other good one to ask is this injury work-related or is it non-work-related? And ask me to even nominate percentages. That's a good way to put it.
Great. Okay, great questions. Okay, thank you, Dr. Sethi. Dr. Sethi
Yes.
can be booked via the MedDirect platform on his own booking page, www.meddirect.com.au/Dr. Siddharth Sethi, and he would also love to take any questions that you have at any time regarding any referrals that you have. Thank you so much, Dr. Sethi.
Thank you.